Now, I am back with our fundamentals of fall prevention, and we're going to talk a little bit about the 7-week fall prevention classes that we offer here at Central Ohio Primary Care. So what is our fall prevention class? It is an evidence-based fall prevention program proven to reduce the risk of falls by 31%. It's offered to COPC patients to help reduce the risk of falls and prevent possibility of future falls. Classes meet once a week for 2 hours over the course of 7 weeks. And each week we cover different topics in relation to fall prevention. So we have a specified topic that we'll cover each week, and we're going to go a little bit more in depth to that later on here. Exercises are also completed in each class to help improve muscle strength and balance to help reduce our risk of falls. Now, when we talk about exercises, we spend about 20 to 25 minutes doing our exercises each week, and then the rest of our class is spent with those topics that we're going to discuss. So who is somebody that might be appropriate for our fall prevention classes? Those over the age of 60 would be good candidates, and community dwelling older adults who can move independently. Those who have an interest in learning fall prevention and how to protect themselves from future injuries would be a good fit. And if they've experienced one fall in the last year or have a fear of falling. Now, somebody who may not be a good fit for the class, just because they may need a little bit more one-on-one specialized care, are those with increased cognitive impairment or who are wheelchair bound and have extreme difficulties with their mobility, mainly because we do the exercises in the class. So with being wheelchair bound, it can be a little bit more challenging, and most of our exercises are done standing. Transportation oftentimes can limit someone's ability to attend classes as well. And if transportation happens to be an issue, we can help provide you with resources on transportation in your area to help you get to a class. And then if you've experienced multiple falls in the last year, it may just mean that you would benefit better from more one-on-one based care as opposed to a class-based setting. So when we talk a little bit about our classes, in class 1, we do our introductions and we talk about fall stories that we may have experienced. We also go over our exercises and we discuss proper form of the exercises, make sure everybody's comfortable with how to do the exercises, proper mechanics for that, and then what we're going to expect throughout the 7-week program. Class 2 will review those exercises, so we encourage our participants to come back with any questions that they have on the exercises so we can discuss those. And then we'll discuss the benefits and barriers of general exercise, not just the exercises that we do in class, but just exercise as a whole. And then we'll talk about how to get up from a fall, learning not to panic if we do experience a fall, and then our proper use of walking sticks and canes and some other mobility devices as well. Class 3 will be heavily focused on home fall safety. So we'll talk a lot about home fall hazards and identifying them. We'll have some pictures that we'll look at, similar to this picture here of the carpet, and then what modifications can be made at home to make it safer for us. We'll also review and practice our exercises here as time allows. Class 4 will have a vision discussion on age-related visual conditions, and we'll also talk about what makes safe footwear. We'll also hit a little bit on clothing hazards here, and then we'll review and practice our exercises again. So those exercises, we want to make sure that everybody is super confident with them. But again, we're going to hit on different topics each week. In class 5, we'll actually have a guest expert, which will be our pharmacist that will attend and discuss medications. So they'll talk about what medications increase risk of falls, and then medication safety and adherence. So they'll talk about, what side effects to look out for, making sure that people are taking their medications properly and why that is important. And we'll also talk about vitamin D and calcium, and it's important in our bone health and injury prevention. And then we'll talk about strategies for getting better sleep. So what are some things that we can do to help us sleep better at night? And then we'll review and practice our exercises again. Class 5 tends to be one of our more packed sessions. We cover a lot of information. We go in a lot of detail with this. Class 6 will have our guest expert of physical therapists that will attend, and we'll discuss mobility within the community. So we'll talk about safety on stairs, steps, curbs, ramps, uneven surfaces, walking in the grass, walking up, like a sloped surface in the grass. And then we'll talk about weather conditions that could predispose us to a fall. And then we'll review and practice our exercises as well. And then class 7 being our final session, we will have our community expert attend this class. And depending on which location you attend, it would either be a police officer or a fireman that are attending the class to discuss community safety with us. So we'll talk about community safety strategies that we can take to make ourselves safer within our community and within our home. And then we'll also review all of the materials that we covered throughout the 7 weeks, and then cover any additional questions that maybe we didn't cover. Back in class 1, we'll have went over, what to expect from the program, and if there's anything that are still questionable to class participants, we'll review that again. And then we'll review and practice our exercises one last time and leave some time for farewells at the end of class. So that's kind of the basis of our 7-week fall prevention program. Again, everybody always asks, how are we going to actually cover 7 weeks for 2 hours? What are we going to talk about? But there's a lot of fall prevention information that we can go over.